Whether you're hiking, running, walking, or hunting, it's all more fun when you can bring the dog along. But accidents can happen, and knowing just what to do can ease the pain for your dog and save yourself a lot of worrying.
Disaster strikes quick in the backcountry. You're at your campfire, it's 10 o'clock at night, your dog runs into camp and he's got a face full of porcupine quills. What are you going to do? I'm Dr. Randy Aker, this is my technician Robin Potts, and this is Tate. We spend a lot of time in the backcountry. Over the last 20 years we figured out the most common injuries that occur. In this video we're going to show you how to deal with these common injuries when you can't get to your veterinarian. We'll show you the proper supplies to have along. We'll show you hopefully some ideas about preventing injury, and we'll make sure you can make good choices for your friend in the backcountry.
For over 20 years, Dr. Randy Aker has been treating field dog injuries and also teaching classes at his Sun Valley, Idaho Animal Center. Realizing the need for more educational and practical materials in the field first aid area, Randy has published Dog First Aid, a field guide to treating sporting dog injuries. In this video, we'll highlight important procedures found in Dog First Aid. Topics covered will include muzzling your dog in the field, treatments for various foxtail-caused injuries, stapling and caring for open wounds, bandaging techniques for ear, leg, tail, and foot injuries, and important steps to take if your dog ingests poisons or gets tangled up with porcupines or venomous snakes.
Last summer, my husband and I went camping for 3 weeks with our 3 dogs. It was a great adventure. We ran into lots of problems. We ran into ticks and porcupines and skunks, and we had torn pads. And we only ended up at the veterinarian once because we had Randy's book along and we knew when it was an emergency and when it wasn't. And we've used the book since we got home from our trip, and it's great just for a day-to-day reference.
Tate's my best friend, but when he's injured, he'll bite me. Most of our technicians getting dogs out of cars when they're injured, we're real careful because we get a lot of dog bites there. A quick way to protect yourself is with the muzzle. The muzzling technique, you can use gauze, you could use a piece of string, you can use a shoestring, you could use a belt. Just about anything you find will work. You start at the bottom, a simple overhand knot over the bridge of the nose, tighten it up a little bit, cross them below the throat latch, and then an overhand knot behind the ears. This will protect you and your friends while you're working on your injured dog. Remember, your health is important too. Foxtails are lethal weapons waiting to attack your dog as the grasses dry out in July, August, September. Foxtails is a general term for grass seeds. These grass seeds are about the same height as a dog. As the dog runs through the fields and these are dried out, they fall off. That's actually how the seeds are disseminated. But when they fall off, they sometimes lodge up the nose, in the ear, in the eye, or between the toes. These foxtails can ruin your trip, especially if it gets in the eye, causes a corneal ulcer, gets in the ear, causes a severe head tilt and shaking. Up the nose, it's a real severe sneeze. They really go after it and they'll start to paw at their nose. Sometimes there'll be a bloody discharge out the nose. Today we'll talk about how to take care of foxtails that have landed in the eye and are trapped behind the third eyelid. Within 2 to 3 days, these will cause a severe corneal ulcer and your dog could actually lose the eye. This is a real simple thing for you to take care of, and if you numb the eye, use your forceps properly, you can be right back out hunting or hiking or whatever you're doing. This injury is common, as I mentioned, in the late fall and in the summer when the grasses dry out. Your dog usually comes up, he's pawing at his eye, he's got a little squint going, and the eye might be tearing excessively. Tate's just picked one up in this left eye here. He's being a good dog and not complaining too much, but over the next 24 hours or so, that foxtail will start hurting him more and more. If you shined a flashlight across the eye in the dark, you might see some whiteness occurring in the cornea, and that's a corneal ulcer starting to form. We have proparacaine in here, which numbs the eye, and this allows you to look inside the eye. Drop a little bit of proparacaine. You only need a drop or two. Proparacaine is like the anesthetic the dentist uses on your tooth, only it's safe for mucous membranes. So if you want to examine the inside of an eye without hurting the dog, put a couple of drops of proparacaine in there. That numbs the eye. Wait a few minutes while it's taking effect. Dogs have a third eyelid. This third eyelid is where that foxtail will be lodged. Normally, this dog's squinting, he's tearing excessively. You actually have to have two forceps. One person lifts the third eyelid up, and the second person retrieves the foxtail from behind the third eyelid. For some reason, those foxtails stick behind that third eyelid, and they rub up and down, rub up and down, rub up and down, and they'll wear a hole in the cornea. This third eyelid is a protector, but for some reason, sometimes the cheatgrass hits there, it flips over it, and it gets stuck right back there. So normally that's where you're going to remove that foxtail, and that'll absolutely save your trip. Foxtail in the toe is pretty obvious. The dog will be licking between his toes. He'll be there'll be a red sore there. There'll be some drainage from that area. If you start to inspect it, you'll see some foxtails stuck in between other toes. This video shows us clipping one up, and you'll see the redness in there. As you get down to the skin level, you'll see this little blister. Now that blister needs to be punctured with a hemostat, and you reach in there. Usually the dog will allow you to do that with no anesthetic. That's an abscess that's about ready to rupture, so if you just pop into there, you can grab the foxtail and remove it. If you get the foxtail out, that wound will heal by itself in 3 days. A big part of this injury is to prevent it. You want to get your dog into the groomer mid-June and get those feathers trimmed out from between the toes, the feathers from behind the hind legs. They call this a filled clip, but basically you're trying to prevent the foxtails from lodging between the toes. Cheatgrass or foxtails in the ear is fairly common. The seeds enter the ear canal. As they enter the ear canal, this is the pinna, or the external part of the ear. We go down the ear canal, and here's the drum right here. The drum's real sensitive. So when that cheatgrass starts bumping against the drum, your dog's going to be in a lot of pain, shaking, holding their head to the side, pawing, etc. The shape of the cheatgrass, it has barbs. It kind of has some tail that comes out on it. So it kind of goes down in a one-way street. It doesn't really want to flip out of there very easily. You're in the field, your dog's shaking, and you would go down, you would take a look, and you would try to remove the foxtail instantly if you could. Most of the time you're not going to be able to get it. At the veterinarian, what will happen is an otoscope will be used to look down the ear canal. This we take and we go look down inside there. We'll visualize the foxtail. These are called alligator forceps, and these are used to pluck that foxtail off the eardrum. And unfortunately, you really do need an otoscope and an alligator forceps to get these out. Occasionally, owners can get them out themselves, but generally you'll have to go to the veterinarian. If you leave them in there for a long time, they can actually perforate the drum. They can get lodged in the middle ear, and that can cause a chronic middle ear infection, which can lead to balance problems. This is the middle ear housing right here. Here's where the eardrum would sit. But again, you'll probably want to go in and get those taken out. Another common injury would be foxtails up the nasal cavity. Same thing, dog's going along, he's head height. He knocks these seeds off, and they enter his nasal cavity. Dogs have a real big, long nasal cavity. These bones in here are called the turbinate bones. You can see there's scrolls and scrolls of these little bones. Right here is called the cribriform plate. That's where your nasal nerves enter your brain. So this foxtail enters here, and immediately your dog will start, it's a pretty violent sneeze. They might paw at that side, and you think at first they got a snoot full of allergies or pollen or dust and they just sneezed a few times. As the day goes on, they continue to sneeze. And even into the next day, they're still sneezing. So this dog should definitely be examined. These foxtails get in these turbinates, and again, this is a one-way street. They continue to work their way up until they get near the brain and into the cribriform plate, sometimes causing a brain abscess, and sometimes seizures or even death. So when we get a history of a field dog, he's been out there, he's acutely sneezing, we have to do a general anesthetic, and we have to take this instrument, put it up the nose, and we search out that foxtail and remove it. Acute, severe sneezing, take him to the vet, probably have your dog's nose scoped.
You know, I've had a couple of field experiences with dogs, and especially with hunting dogs like this, where one of the first times out duck hunting, and dogs gets pretty excited on the retrieve, and after the bird falls in the water and takes off, the dog just sprints right through a barbed wire fence and tore the end of the ear right here. And there's a little, I guess there's a little vein goes right around the end of the ear. Well, it tore that vein, and then what happens, it just bled all over the place. And so I had a dog covered in mud and blood, and it was just a mess, and I had a hard time stopping it. I ended up wrapping tape all around the head in the field, and which stopped the bleeding, but it was a real mess getting the tape off. And later, Randy turned me on to a good tip, which was carrying a little bit of a nylon stocking with me so that I can slip the nylon stocking over the head and thereby pinning the ear down after, because I couldn't get the bandage to stay on. Every time the dog would wag its head and shake, the bandage would fly off the ear, the blood would start all over again, and it was just a mess. So that little nylon stocking slipped up over the head, and it pinned the ear down, and it made it a great field bandage.
A lacerated ear margin is a fairly common injury. It's usually as the dog goes through a barbed wire fence. The edge of the ear hits the barbed wire, or it gets caught on other substances, but there's an artery that runs around the edge of the ear. When the dog shakes its head, the centrifugal force flaps blood all over yourself, your car, and surprisingly, this injury goes on for days and days and days with blood flying all over. This simple ear bandage we'll show you right now will help control the bleeding and actually get the wound to heal. Basically, you need a tubular structure. This could be a nylon stocking, a white men's tube sock. This is cast stockinette. But you cut a hole for the non-affected ear. Basically slide the tube over the head. Now this is the normal ear. This is the ear that we want to keep from flying around and sending blood all over. So we get that kind of comfortable on them. Again, we'll take our elasticon or our stretchy tape. We put a wrap around the front, cross at the top of the head, put a wrap around the back. Try to incorporate the ear right there. Try to make it comfortable. We'll usually put a little white tape one around the front, one around the back. It's sort of a fashion statement too. All the dogs are going to want to have one of these when they see it. No, really, this will These margin cuts just bleed and bleed and bleed for days. You don't really need to shave the hair off. You don't need to put iodine on them. We just need to stop this centrifugal force from breaking it open time after time. And this bandage alone will take care of those ear margin cuts. And most dogs tolerate that bandage real well. Surgical stapling is definite for you. You really want to know how to do this. It's not very hard. Lacerations are common. The most common lacerations on your field trial dog will be going through a barbed wire fence. They'll hook themselves right down here. They'll hook their knee. They'll hook their chest. These are usually shallow wounds and they're easily stapled up. Occasionally, I've used it on myself. I've used it on my friends. We're in an emergency situation, and this is a human surgical stapler, and it's just much simpler than trying to